Good evening, friends. So, although we have done PCOS in past, when I was talking to Simi last time, after I saw her talk was liked. Another area of lifestyle management is PCOD or PCOS. So, she said she has a proper diet management of PCOS, PCOD, which we family doctors generally struggle to advise patients. So I thought of skipping this topic, and I thought first 15 minutes I will just brush over the Clinico pathology and then hand over to Simi. The common menstruation disorders we family doctors face: premenstrual syndrome, no need to do hormone test, clinical diagnosis as well as management is very simple. You give folic acid, high dose for 3 months, and 95% of patients will be fine. Abnormal uterine bleeding, which requires a detailed history, which requires investigations, and then which requires management. At times, you may have to refer for surgery also. And then polycystic ovarian syndrome or polycystic ovarian disease. Today, mother of a patient asked me, "Doctor, is it PCOS or is it PCOD?" I said, it's one and the same. Some people call it disease, some call it syndrome. Why it is called syndrome? Because it has symptoms and signs of multiple systems of the body. A big name, but not scary at all. What is PCOS? In this, the ovary is symmetrically enlarged and riddled with small follicular cysts of about half to 1 centimeter in diameter. As many as 30 cysts can be seen at a time, but no report will tell you numbers. They will just tell you multiple cysts. It's a hormonal problem defined by the collection of its symptoms, because symptoms are not only OBGY, not only menstrual. Usually thought to be a lifetime female hormonal disorder or imbalance. What happens is a egg matures, and at the time person ovulates, and that matured egg becomes a follicle, and patient may conceive if she's in the reproductive age group and she's having proper relations, unsafe relations. That does not happen. The egg is not exposed, the follicles do not mature, and that gets converted to a cyst. The cysts then contribute to hormonal imbalance, and this imbalance causes more cysts. What causes the vicious cycle to start is not well understood, and it will vary from patient to patient. Insulin, diet, stress, fat, hormonal problems, all are implicated. Because type 2 diabetes is a common associated feature, or pre-diabetes. Diet management, stress management, exercises helps relieve the symptoms of PCOS. We don't know what it causes. Now, how do I explain to a patient? I explain to a patient or patient's mother over 2 minutes. Pay attention to this. I say that a woman's reproductive life is 10 to 50 years. That is 40 years. 12 months in 40 years is 480 months. A normal female will produce 480 eggs over her lifetime. 240 from one ovary, 240 from another ovary. What happens, we don't know. Somewhere in between, these premature follicles, they stop growing. Because most PCOS, if you ask, no, they've had a normal menarche, they've had normal frequency of periods in the beginning, and then they become irregular. So I say that certain follicles fail to mature, and as nature has made it perfect, it is pre-decided which month, right ovary or left ovary, which follicle will mature. The month the designated follicle does not mature becomes anovulatory and no periods. This is PCOS, and this is what we have to manage. Stell and Leventhal in 1935 defined it as association of amenorrhea with polycystic ovaries and variably hirsutism and or obesity. Today, we identify PCOS with hirsutism and obesity and prediabetes. American College of Obstetrician and Gynecologist and National Institute of Health in 1990 said it's a condition of hyperandrogenism and chronic anovulation, excluding other causes. We know that only after ovulation occurs, in 15 days, the period will occur. No ovulation, no period. 33% of women who are obese, 8% of women who have type 2 diabetes, and 27% of infertility cases which are not producing a follicle have PCOS. So you can now understand and you can accept that it has various presentations. 5 to 10% of women of reproductive age have PCOS, which is as high as diabetes. Epidemiology, prevalence 4 to 6% females worldwide. 75% of women with irregularity of menstruation or infertility. What's the association between insulin resistance and PCOS? The treatment of insulin resistance is diet management and exercise. The treatment of PCOS is diet management